Welcome to a new episode of Medicine in 3 minutes. As usual, we go straight to the point. The subject is bravely made clear and often illustrated. Let's start. Today's topic is about snoring and sleep apnea. The first part is devoted to snoring. Then we will deal with sleep apnea. There is a remember and sleep diagram, definition, obstructive sleep apnea, central sleep apnea, mixed sleep apnea, sleep diagram, epidemiology, cause, physiopathology, symptom, polysomnography, treatment, CPAP, and medication. Regarding snoring and sleep apnea, there is some risk factors. Hypertension is twofold increase the risk. Cardiopathy 3 times, stroke 4 times. 40% of obese have sleep apnea. 60% of male and 40% of female over the 60s. How the snoring occur? This diagram shows a hard and soft palate. Between hard and soft palate, there is a line junction between them. This line junction is vibration line junction. Actually, the sound of snoring is caused by the turbulent flow of air, the same process that generated the sound of fast flowing water in rapid of a stream. Risk factors include male gender, obesity, alcohol, smoking, tranquilizer, and muscle relaxant. We can identify some organic cause of snoring, like nasal polyps, septal deviation, nasal col enlargement, uvula enlargement, and tonsil. Here is about nasal polyps. Look for aspirin idiosyncrasy. It gives some nasal polyps. There is a triad which is asthma, nasal polyps, and allergic rhinitis. Here is to show the hypertrophy of cornea. What about investigation? Only if severely symptomatic. What we do, nocturnal polysomnography and airway assessment like CT and MRI. Polysomnography include electroencephalogram, brain waves, electrooculogram for the ACE movements, and electromyogram for muscle tension. How we treat that? Sleep inside, position therapy, and weight loss. Nasal dilator, no invasive external dilator made with elastic adhesive backing applied over nasal bridge, tongue retaining device, mandibular advancing device, but risk of developing obstructive sleep apnea. Sleep inside and weight loss. Sleep inside because spine sleep make the snoring worse. Let's review what we say. Snoring results from soft tissue vibration at the back of the nose and throat due to turbulent airflow through the narrowed air spaces. Risk factors include male gender, obesity, alcohol consumption, ingestion of tranquilizer or muscle relaxant, and smoking. Physical exam, obesity, nasal polyp, septal deviation, hypertrophy of the nasal turbinate, and enlarged uvula and tonsil. How we treat that? Sleep inside, position therapy, and weight loss. Nasal dilator, non-invasive external dilator made with elastic adhesive. Bacon applied over nasal bridge. Tongue retaining device. Mandibular advanced device. But take care about developing obstructive sleep apnea. Please support the channel by purchasing this ebook at KDP Amazon. Thank you for watching this episode of Medicine in 3 Minutes. Would like to click the button and subscribe. Your comments are very welcome. Thank you.